Hey guys, it's Dr. Emer. For end of our day, our week here in Manhattan, finishing up with our great acne scar combination at darker treatment number 1. Last time we were here, now we're working on treatment 2 to really improve his scars. You don't have a before and after, do you?
I do have a before.
We have a before on there to show you guys the irregular texture that he had. We've already those white spots turn a little more right.
So right here, you can see all the irregular spots.
You can see all the irregularity, but look here now. Look how much smoother it already is in one treatment compared to what it was. And given that he's a darker skin, much more difficult to treat. Well, why are we able to treat this? Years ago, we really weren't able to, and the only thing we had were non-ablative options. But here we are now doing a combination of a hybrid fractional laser with ablative laser. We're using our halo here, and halo can be customized to any skin type. Now, obviously, the darker you are, the more risk lasers cause hyperpigmentation. So with that said, we have to do a reasonable setting that would give us some results in a short period of time. A little more difficult the darker you are, but we're able to treat him. We're just going to have to do more sessions.
And most importantly, guys, post-pre, and maintenance.
Yeah, so emeragecosmetics.com, you guys. We have our pre and our post care in all of our bundles. We call them bundles there because I think they're really important. A unique combination of products used to prevent hyperpigmentation and promote more quick healing. We're doing that here. We did that with him today, a lightning exfoliation peel before. With all our skincare products, he's using the Emer Skin products and following our regimen. What I would have him do is right when he peels, start derma rolling. We have our derma roller on Emerage Cosmetics. Serum. This is our hyaluronic acid, vitamin C. You can show them. Hyaluronic acid, vitamin C, and other botanical ingredients in there like thyme, cucumber, aloe to calm the skin down. Really good for our darker skin clients. We're also going to use our intense hydration mask. We have that there too. The Emer Skin Intense Hydration Mask. That has our peptides in it, our tea tree extract, and our licorice root, all to help him calm down and prevent hyperpigmentation. He'll start retinol, hydroquinone, and my full protocol of healing, including stem cells from anti-age, immediately. So
they are saying, Doctor.
an outcome here doing this. Fraxel would take, and I did the clinical trials for acne scars years ago for Fraxel, 2006, 2007, would take a minimum 5 treatments to get what I'm going to see in 1 or 2 here. And it's not going to be equally as good in terms of the scarring. So I love Fraxel, you guys know that, but Halo is our improved technology. Again, ablative with non-ablative and safe on a darker skin tone. Now, I'm going to be doing a CO2 resurfacing as well on him. That's for my expertise. He did great in the first session, no problem. But I wouldn't go trying that at home if you've never done it before. And you can see all those little dots. Georgia, show them those dots.
Got some fans on here. Someone said, hello, my favorite doctor.
Hey.
Someone said both products are great.
Thank you. Make sure to keep using them. I love them. Hyla B is out right now for another month or so. So in the meantime, use the Botanical Serum plus the Faith Moisture Lotion. That's a great product. Combining makes it equivalent, if not better, than Hyla B because you're using 2 products that address 2 different concerns, pigmentation and hydration. All right, we're at the last pass here. We're using our innovative optic goggles, which have been customized to literally cover his entire globe so he's protected. Perfect. All right. So now we're going to rotate. You guys can see all those dead skin cells that have built up. Perfect. We'll wipe those out. And let's flip it. There we go. Wipe them off. And go on to our next section. How are you feeling? Not too much pain?
No.
Okay, good. So he does have topical numbing and nerve blocks. We do a double topical. We do pills as well if people need it. Typically, I tell them to take the pills because the nerve blocks can sometimes make you a little shaky. Other than that, most of my patients do very well. I think we've only had 2 from the time we've been here in the past 5 days of over 30 big laser combinations that had some pain. Everyone else was very tolerable. Show them again his before so they can take a look at what it looks like now over here.
Here's the before photo of our patient's irregularities.
Take a look at this smooth. And look
And
at this smoothness now. Much more smooth in this area. This is where he really notices it. So we have treated Indian, we have treated Hispanic, we have treated African American, we have treated mixed ethnicity, all since we have been here, as well as as white as can be, like Casper the Ghost. We have done it all, even with one device. So you're not gonna find a device.
So what's the downtime for the halo and fractional combo?
5 to 7 days, guys.
5 to 7 days, depends on the settings you use too.
Most people peel around day 5 and are pink for another week or 2 if we do it really strong. Like we saw some pictures today from a client of ours that Jordan was showing me. He's going to be red for a few more weeks.
Social downtime though is 5 to 7 days.
Yeah, and at least 3 days of staying home and taking it easy. We don't want you to get an infection when you have scabs. If you go out, you just put yourself a little more at risk. However, using my Emer skin masks twice a day prevents that because of the tea tree that's in there. We give antibiotics as well. And yeah, a lot of my patients will also add in the enzyme polish. Can you come wipe this? Can you come wipe? You guys come wipe. What? I don't know what that means. Yeah, I know. That's what I figured. But no, not in between the CO2. No, I mean, I guess I could. That's fine. But I wasn't going to renumb him. So I don't want to renumb. Alright, so I'll do it, but I don't want to renumb him.
Besides the mask, which I have, what's the post-care considering the broken return trip?
Oh, there's so many
guys
things.
need to get a consult with us, guys. Send us a DM.
But
Full name, email, phone number. Go to our website. Let's get a virtual. We'll get you set with all the skincare.
But I'll tell you some of the things you need. The Cleanzyme from Jan Marini and the Emerage Skin Enzymatic Polish, both as your enzyme cleansers. Sente Dermal Repair and Refit Eye for your peptide and moisturizing. Our Botanical Serum, our AOC, our Moisture Lotion from Faith, as well as Anti-Age Serum and Brightener. Those are the main ones that you're going to use, and at least twice a day the masks. Now, a lot of my patients will use the derma rolling ampule, the Aerify ampule, or the Anti-Age, I'm going to turn your head a little bit, microneedling ampule, as a primer. You basically wash the face. You can also use the AXE vitamin pads every day after you cleanse.
Patient said he has a consult with you coming up.
Can't wait. Make sure they schedule you for also a skincare consult same day. If they haven't done that, call them and do it.
He said he's writing all this down.
Excellent. No need to write it down. We'll send it to you when we do your consult, but you can check it at emeragecosmetics.com. We're going to pre-treat with Cosmelon peels in someone like him, and post-treat with the post-care plus the botanical plus the ACNE plus Restore C10X. That's another great product that prevents hyperpigmentation in darker skin tones without being a retinol. Last pass here.
So excited to see Lindsay tomorrow.
Can't wait. Love Lindsay.
Lindsay said, Jason, so want to hug you.
Give me a hug, give me a kiss, whatever you want, baby. As long as we get you good skin, whatever it takes. You guys also have to understand lasering is a process. You cannot go in the sun. You have to be really protected, and you have to continue skincare and treatments. If you don't continue, you don't see the results. Finishing with the nose here. Okay, so that is the halo. We're gonna pause right now and get ready to do CO2 very soon. All right, I'm gonna give you a second break while she sets that up, okay?